As the years passed and our budgets got worse, we saw the decline in not only the population on the Oregon Health Plan, our Medicaid program, but we also began cutting services on what we call the prioritized list. And so this is when John Kitzhaber was out of office. He left office, and he came back and said, we have to fix this core problem. We won't cut people, and we won't cut services. What we're going to do with the industry is you have a choice. You can provide care differently, or we're going to cut your rates. And so this really created a sense of inevitability in our state when we had a looming budget crisis. The Affordable Care Act had just passed, and he really put the industry in a box. And I think that some of the reforms that other elected leaders in our state really stepped up. So we have Dr. Alan Bates and Ben Westland really reach across the aisle to say, this is the way it's going to be. And this is what the coordinated care organizations were born out of. We call it a burning platform. Actually, you'll hear Oregonians talk a lot about the burning platform that created the CCOs. Went immediately to a global budget for our Medicaid population that were accountable to a set of metrics, and we packed this idea in a box and took it across the country to the federal government and took out a loan, actually. And we made the same agreement that Maryland did, that if we could hold our rate of increase to 2% over a 5-year period, could we borrow some money to prop up the system as it currently is? And we would pay this loan back if we were to fail. And not only would we pay it back, we would pay it back with interest. So we went to CMS as if they were a loan shark and made this agreement. And so came back with, actually we just threw gas on the burning platform to really change the delivery system and the way it looked.